Go ahead.
Thank you very much. Thank you, Madam Chair. This is one of my last estimates, and so in addition to thanking you very much, Minister, for being here and your officials for being here, I just want to say thank you to all the folks who make these committees happen. Thanks to the pages, to the clerk, to the folks in Hansard, to the security folks, and everyone who's helped make this such a smooth process. Again, Madam Minister, the opportunity to participate in the Child Intervention Panel was one of the most eye-opening, challenging but rewarding experiences of my entire life. So thank you for including me in that process. I learned a lot, and I hope we have an opportunity to make a difference. So I will start with questions relating to the business plan, page 27, the performance indicators. One of the things that we learned from the Child Intervention Panel was the remarkable overrepresentation of Indigenous children in care. But when we look at this performance indicator 3A, we're looking at children receiving child intervention services as a percentage of the overall child population in Alberta. But I don't see this broken out by the number of Indigenous children. And I guess I'm just curious, given the focus of the panel, what we've learned, what we know, and the recommendations out of that panel, I'm just curious if in future we could break out children in care children receiving services by the percentage of Indigenous children receiving those services as well.
Yeah, so I did just want to talk a bit about the fact that we regularly release information on the child intervention standards, which I think is where that information is captured quite strongly in terms of sharing that information. So we did work with the Office of the Auditor General in terms of our practice measures in terms of sharing some of that information. So the one of the standards that is shared is information on the representation of Indigenous families within child intervention and certainly supporting the work of the DFNAs in that work. But if you do look at outcome 3, in terms of the performance measures, it does break out the percentage of Indigenous children and youth who did not return for additional services within 12 months, and then non-Indigenous, and as well as those who are placed in family-based care. So we did, actually have 3 different measures throughout the business plan that are specifically breaking out Indigenous versus non-Indigenous to help understand that overrepresentation going forward.
Okay, thank you very much. And just looking at the next 3B, while that percentage being around 40% of children in Indigenous children foster kinship care who are placed with Indigenous families, and it's good to see that number is going up and trending upwards. That still leaves not quite 60% of Indigenous kids not within those families. So what strategies do you have in place to, that was again one of the really clear messages that we heard from the panel. What strategies do you have in place to make these numbers go even higher?
Yeah, so again, I did speak with that a bit with member here. There are really complex situations, certainly within Indigenous communities and Indigenous families, in terms of the impact of historic trauma and the impact of poverty. And so I think there continues to be some challenges that we really need to deal with the root causes in terms of figuring out how we can keep communities healthy and families healthy so that there's more healthy families in order to do that. Having said that, our staff work very, very hard in order to do the family finding work, to explore what all the possible options are, and to try to find a family who's both willing and able to take that family in and to provide that child a safe and healthy home for them to live in. Certainly, we've looked very closely at how we assess homes, ensuring again that the child can be safe and healthy there, but making sure that the standards are reasonable, so we're not actually unintentionally risking out, households that actually could provide a loving and safe home for those children. Finding that right balance again, of course, with making sure that they absolutely can provide a safe and healthy home for that child. But, having found a family and having them being willing to do that, then ensuring that we work with them to make sure they have support. So they did get an increase this year along with foster families in terms of the per diem support for children. That applies to kinship families as well. But we're certainly working with them to ensure that they have access to the training and support and education that they need to be able to support a trauma-informed perspective and all of the other complex needs that they might have to deal with those children. I do expect that out of the conversations and engagement we have regarding the action plan, that there to be more. And that's certainly one of the areas I'm very much looking forward to being able to provide, some additional supports to those families to make sure they can be a successful placement.
Thank you. Turning now to staff within Children's Services, one of the discussions that happened through the panel was the high turnover rate of frontline workers within Children's Services. You've talked about a few of the strategies, peer mentoring and those sorts of things. Are there any other strategies in place, and have we got some data that we can track to identify trends and hopefully make those trends move in the right direction? And if there is some data, is that something that could be included in future business plans?
No, that's a good question. Most of the measures that we just talked about are new. They're things that since we became the Ministry of Children's Services, and we've been able to do that focused work within the staff, within child intervention, to have those conversations, we've been able to get down and figure out what programs they needed. So the peer support program is going to be put in place, this fall. Why can't I think of it? Conflict management, thank you. The conflict management program is going to be put in place this May. So we don't have data from the outcomes of those yet, but certainly anecdotally have heard from staff that they feel more supported and are very thankful for being able to be the separate ministry and feeling valued. And I'm looking forward to seeing that represented in the engagement assessment work that is done, and seeing the reduced turnover over time.
I hope so too, because there's some pretty remarkable people that work in the system, and we obviously want to keep as many of them as we can. I guess I want to turn now just to continue going down this path, but one of the great challenges in your ministry, in this whole area of children's services, is how do we ensure that there is public trust, that Albertans know that the Children's Services acting on behalf of all Albertans in taking care of very, very at-risk children who've really gone through some pretty terrible circumstances. How do we ensure we have public trust and that there's sufficient transparency? Because we've certainly seen a lot of let's call it feedback around a sense of a culture of secrecy. How do we square that with the legitimate need for privacy and for not just children receiving care, but their siblings and families and relations, as you've talked about? But also, how does that factor into what can look like a culture of blame? So that's one of the things we talked about in the panel, you and I have talked about. And I really struggle with as an opposition member. Something happens. We go into the legislature and we point fingers and we yell, and you can see how that can cascade through the system, and people now just look for someone to blame, when frankly at times there's enormous complexity. Now, if something has been done incorrectly, or if someone has truly acted irresponsibly, and there is accountability to be found, that there should be, and that's not to say that anyone who's done bad things should escape accountability. But how do you square all of that, I guess, and without taking the next 10 minutes to answer the question, because I have more. But I guess I just want to sort of see if you can just give me, as brief as you possibly can, some comments on that, because that's something I know we talked about at the panel.
Yeah, I think that is a really great and very complex question because, I mean, what you're talking about primarily is public perception, and that is something that is complex. And I think when we bring children into, we all get very emotional about children, and it provokes a response that is often based on emotion. I'm really proud of the work that our staff do. I mean, if you think that there are approximately 10,000 kids in care, we don't hear a whole lot of stories, which means there are almost 10,000 stories which are actually providing quite successful service. And again, the practice shift in terms of wrapping around families, I think, is making a huge difference in terms of outcomes, but also the relationship with families. And so I think we can't underestimate the fact that families, as they feel wrapped around and engaged and supported, are sharing with people within their circles about the fact that child intervention is helping them to be successful. Having said that, I do think that some of the work that has been done will help in terms of shaping that. In terms of the OCYA, again, continuing to do reviews, but reviews of every single death will just help frame and understand, I think, patterns and understandings of what happens going forward. In terms of our quality assurance process, it's being amended to be quite immediately responsive to any concerns that come up, to ensure that it's that continuous quality assurance. So as things arise, we're seeing change immediately.
Yeah, thank you. So I really apologize.
Oh no, and just one thing I just want to say is we are going to do a survey with families on the care that they received. So we'll look forward to sharing that information so that there can be some understanding of the positives that come out of that directly from families, which I think will be valuable.
Good, thank you. That answers a question I was going to ask later, so thank you. And I would really encourage you, I mean, you know how I feel about data.
Yes.
And so that's certainly something I think we should always be gathering and not be afraid of it. You know, it is what it is, and I'd rather know. So that's fair. You know, one question, and again, we talked about this through the panel, you and I have talked about it, increasing representation of both the frontline workers, and it was a question that was asked previous by Ms. Sahir, the workers who serve that population, the kinship care and the parents look like the people that the population they serve, but equally that the leadership within children's services looks like the population they're leading. And with the obvious exception of the people who are around the table and with you here today, that's obviously an important step in the right direction. My understanding is that the population of children's services workers are overwhelmingly women, but that isn't necessarily reflected as we move up through the organization in terms of leadership. And I think we saw some of that through the panel. I'm just curious if there's work going on to ensure that not just the population, that the workers who serve that population look as much like that population as possible, but those who lead the workers also look as much like that population as we can. Is that something, and perhaps even using GBA Plus as a model, but is that something you have some specific strategies to achieve? Yeah, so, you know, I think there's two different aspects there. I think you were, if I understand correctly, referring both to wanting to see more Indigenous folks, but also the female-male ratio there, right? Okay, so I'll speak first to increasing opportunities for Indigenous individuals to be part of our ministry. So we do have the Indigenous Internship Program. So that was developed in 2012 to increase the representation of Indigenous people in the workforce. And I think it's very much as we increase the number of people who are Indigenous across the ministry, that there'll be more opportunities to see them excelling in leadership as we go forward. I also hear what you're saying. I think that, again, you know, internally looking at our GBA Plus analysis, you know, as we continue to move forward with that, we'll also be looking at our workforce and our leadership. You know, I'm certainly proud when we get together, you know, for a senior leadership team to have some amazing individuals at the table. But in terms of who my deputy minister and the assistant deputy ministers are, there's only one male at the table. And, you know, which again, is representative, I think, more so of the percentage at
within the workforce. We are working with education and the universities to increase the profile of the work that we do and help recruit and understand broadly, including speaking with Indigenous students in terms of recruiting those as well. So certainly there is definitely more work to be done on this. One of the questions that we're asking in the engagement sessions that we're doing for the action plan is talking specifically to Indigenous communities and their membership and their leadership to say, what could we do to increase the number of individuals from your community who choose social work as a profession and then are successful in making their way through education and then choosing children's services and being mentored through that. So that's certainly going to be an ongoing process and is very much a high priority within our ministry to achieve.
Glad to hear it. Thank you very much. I want to move on to page 27, the risks, information technology systems, infrastructure you've identified. And also outcome 3 on page 26, ensuring children are safe and supported. What IT security controls exist to ensure that all that data that exists within the system is secure? And does that extend when workers are working off-site or outside the kind of 4 walls of a children's services office?
Yeah, one of the things that I've been really thankful that we've done as a government is centralizing some of those opportunities for those corporate services. So Service Alberta and their expertise certainly has taken on the responsibility of that for us. However, we do absolutely follow best practice in terms of ensuring that we take the protection of this incredibly intimate and private information very seriously and support continually moving forward with best practice and ensuring that as technology changes and opportunities changes that we're current with the current challenges in terms of IT security.
Okay. So and how proactive are you in doing that? And so do you have programs where you go out and look for instances of misuse or do random audits? And if so, do we have any data that you can share on security breaches or inappropriate use of children's services IT infrastructure?
Yes, but again, Security Service Alberta is responsible for that and would be the ones who would have to share the data.
So you kind of, if you will, contract that out to Service
Yes.
Alberta. That's their whole thing. And does that also include when they're when children's services workers are working at with the DFNA or off-site or traveling, they kind of taking their laptop with them, that kind of thing? Is that something that happens within?
Yeah.
Is that your accountability in terms of providing that input to Service Alberta in terms of what your needs are, or are they entirely responsible for it?
So we do have some sharing of data systems, which so then they would be again through that system would be maintained by Service Alberta. But in terms of our relationship with them, in terms of information management, it is part of the contract that they maintain privacy standards in terms of things that would be not electronic if we're moving away from IT in terms of the paperwork. But in terms of electronic systems, it would be the same.
Okay. And do they share with you any information about audits they do or the proactive breaches, or is it all kind of reactive, or does that just happen in Service Alberta? And
yeah, if they found anything, then they would be sharing that with us.
Okay, thank you. I'm going to spend the last minute and a half here before the next round on a different topic. So page 22 of the business plan, diverse families and childcare. I'll try to get this question out. May have to come back to it later. The affordable childcare spaces. One of the constituent who very much wanted to go back to work couldn't find an affordable childcare space. So I certainly laud your efforts to increase that. One of the concerns I have is it's important we're helping the people who need help. And so what I'm interested in is if you've thought about some means testing in the $25 a day daycare project, because I've heard anecdotal / fairly well-established factual stories of people who have quite a substantial income who are taking advantage of these spaces. Frankly, they don't need the help. Lots of people who do. Have you thought of any sort of means testing on this particular program?
Certainly the ELCC centres have been from the beginning intended to demonstrate what universal access to affordable childcare looks like, and so we're continuing to see what that model looks like. As much as we want to support those who need the financial support for it and demonstrate that. And I think the particular sites that we've chosen often are helping families who solely need that economic support, so they don't have to choose between diapers and childcare. But I've also heard from nurse practitioners and teachers, who are choosing to go back to work because of the ELCCs, and so that's an important dynamic as well.